Welcome to the Garden House Hospice Care Annual Meeting. This year's meeting, like a lot of things this year, looks very different. We thank you all for joining us virtually today and look forward to the days where we can welcome you all back to the hospice to join us in person. As 2020 comes to a close, we would like to take the opportunity to reflect on the past year and share our challenges, successes and thanks with you all. Despite the many difficulties Garden House Hospice Care has faced in 2019-2020, thanks to the immense community support and highly dedicated staff and volunteers, the hospice has continued to provide an impressive range of services for those with life-limiting conditions. The impact of the coronavirus on our work in the current and future financial years must not be underestimated. At the start of April 2020, with all our trading activities stopped and fundraising opportunities severely curtailed, we faced a potential shortfall in income against our target for the year of £1.3 million. More information on government assistance and the success of our urgent coronavirus appeal will be detailed later in this meeting. Next year will be even tougher, as it is unlikely we will not have the support of government grants to hospices. In order to maintain our excellence in care and develop our services, we will need to look at new ways of generating and growing our income. Collaboration with Isabel Hospice in Welwyn Garden City and others is already introducing new ways of working, which aim to enhance the experience of patients and their families, and also, where possible, reach more people as well as delivering better value for money. We will continue to underpin everything we do with strong governance and work hard as trustees, supporting the work of the CEO and her staff. Before handing over to Sue Plummer and Jane Dingemans, I would like to recognise the support we have received from the community and the outstanding contributions and progress achieved by our staff and volunteers, and extend thanks on behalf of myself and the Board of Trustees. To those staff who trained or retrained to support our staff on the front line at the height of the current crisis, thank you. To those nursing and care staff who continue to give their all for our patients, working under severe pressure despite operational difficulties, thank you. To the support staff who work quietly in the background to keep the hospice running, thank you. To those staff who were furloughed and to our volunteers who were not able to resume their roles, thank you for your understanding. To those involved with the recently completed building project, particularly the grant-making bodies who provided much needed financial support, thank you. It has made a massive difference to the environment for patients and families. To all of our clinical, non-clinical, fundraising and trading teams who have worked so hard to keep the patient at the heart of everything we do, thank you. To the senior leadership team who led the organisation during this period, thank you. And lastly, to our many supporters in the community, your kindness and continuing encouragement sustain us and help us to protect the future of end-of-life care in our community. Thank you.
Hello, my name is Sue Plummer. I'm the Chief Exec of Garden House Hospice Care. Welcome to our annual review. I would like to add my thanks to John for the amazing support we have received from the community, staff and volunteers. The hospice set ourselves strategic objectives for the last year, and it's great to be able to report that despite the difficulties of COVID, we have managed to achieve many of these. Our key themes for the last year and the coming year are everybody, excellence, empower and educate. Jane will talk about our clinical work, so I'd like to reflect on how our support staff have worked quietly in the background to enable us to deliver our clinical services. The catering, housekeeping, facilities and finance team have played a pivotal role in supporting the delivery of clinical services. The delivery of our extensive building programme has allowed us to upgrade our building so we now can provide a first-class facility for the local community for the future. With thanks to the hard work of our fundraising team, we have delivered an extensive calendar of events and campaigns, raising over £1.4 million in income to support the vital work in the community. Last year was a tough trading year, and we saw in excess of £1.5 million still raised by the trading company, with year-on-year increase in profit thanks to the very hard work of trading and volunteers. As we saw the financial year come to an end, we felt the impact of the COVID pandemic on our income generation, particularly with shop closures. I would like to thank our trading staff and volunteers for their continued support as things have progressed over the last year. Both trading and fundraising staff have stepped forward to support their clinical colleagues in a range of fields, including retraining to deliver frontline clinical services. We saw a fantastic level of support and commitment from all areas of our local community, businesses and grant-making bodies.
Hello, my name is Jane Dingemans, Director of Patient Services at Garden House Hospice Care. I am pleased to have the opportunity to share with you an overview of the clinical services provided over the last year, up to April 2020, and the challenges and achievements in more recent of times. I would like to start by thanking the staff and volunteers for their dedication and our community for their amazing support, particularly during the difficult challenges of the last 8 months. Your support and commitment has enabled us to continue to provide clinical services for those with life-limiting conditions and their loved ones. The clinical strategy is centred on the 4 key themes of the organisational strategy, namely everybody, excellence, empower and educate. And as such, our key clinical priorities for 2019 to 20 were matched against these objectives to include equity of access to care, care coordination, ensuring safe, effective, caring, responsive and well-led services, effective and efficient and innovative use of resources, reaching and supporting patients and their families and carers earlier in their illness, enabling people to live life to the full, and sustaining a highly skilled workforce prepared to care. Despite the challenges we have faced in 2019-20, we have continued to grow and develop the clinical services to meet the needs of the community, providing care for over 640 unique adults living with cancer and non-cancer illnesses, and over 280 carers and family members. Their needs have been supported by the 8-bedded inpatient unit, which saw over 200 admissions during 2019-20. Our Hospice at Home and Continuing Healthcare Fast Track community service, which together supported over 250 patients to remain at home with 8,000 visits. A wide range of palliative and rehabilitative day services delivered at our Hawthorne Centre and in community hubs in Stevenage and Royston, supported over 400 patients with 5,000 attendees. The Family Support and Children's and Young Persons Pre- and Post-Bereavement Service provided support to patients, carers, children and young adults. The Care Home Education Facilitator supported over 200 care home members of staff in providing high quality, patient-centred care. The Admiral Nurse Dementia Care Service supported over 35 families caring for loved ones with advanced dementia. And our training and education team provided palliative and end-of-life care training to over 750 health and social care providers. In addition, Garden House Hospice Care hosted 2 full-time frailty clinical nurse specialist posts for the North Herts locality, who directly cared for over 1,500 residents living in care homes in North Hertfordshire. In partnership with Hertfordshire Community Trust, we successfully implemented the single point of referral service for Garden House Hospice Care and community specialist palliative care referrals to ensure that the right help is delivered by the right services at the right time. We have continued to work in partnership with providers to ensure that all patients who require services of the hospice are referred as early as possible to the appropriate hospice service. We have brought services closer to the patient's home. These include our newly recruited Admiral Dementia Care Nurse, our community hubs in Stevenage and Royston, and increasing the number of community healthcare beds from 5 to 10. Not to forget the support of our Compassionate Neighbours scheme in supporting the clinical services and patients with over 400 referrals and 180 trained compassionate neighbours supporting the work of the hospice. Just as we were approaching the end of 2019, Garden House Hospice, like everybody else, was faced with the unprecedented pressures of the coronavirus pandemic, which tested the resilience and responsiveness of our workforce and clinical practices. The pandemic imposed significant challenges to the services that Garden House Hospice provides for patients, their families and carers, with the need initially for several of our clinical services to be suspended in line with clinical guidance. However, we responded fast, putting plans in place to ensure that our commitment to patients remained unchanged, putting our patients and their families at the heart of everything we do. New approaches to delivering care and supporting patients have taken place. The way in which we manage our activities and we communicate with one another and our patients, their relatives and healthcare professionals has radically changed in our response to the coronavirus. We have moved away from face-to-face appointments and group activities to supporting patients via remote consultation and virtual sessions. These have proved to be really successful and will be incorporated into our practices going forward. The coronavirus meant rapid development and a significant increase in the use of virtual platforms to deliver education and training. The pressures on care homes has been immense, and the Frailty Nurse Specialist Service, along with our education team, played and continue to play an important role in supporting the residents and care staff. Trading and fundraising team, who otherwise would have been furloughed, underwent training to support the care of patients in the community as clinical support workers. With the support of redeployed staff, we increased our bed capacity on the inpatient unit and virtual beds in the community with funding from the CCG to ease the pressures on our local hospitals. Our medical team have provided support to GPs in the community and to patients through remote consultations. Bereavement support has continued by telephone, with the service extended to people experiencing bereavement who have not been cared for at the hospice. Working against the challenges of the coronavirus, accessing personal protective equipment, testing of patients and staff, and importantly, the impact on the staff and volunteer workforce, including their well-being, cannot be underestimated. However, we remain committed to helping to widen the reach of our patient-centred care to the needs of our community during 2020-21. Delivering our vital care to those living with cancer and other life-limiting illnesses is only possible because of the dedication of our highly skilled workforce and the generosity and enthusiasm of our supporters. Thank you.
The COVID crisis has added huge pressure not only to our service provision but to our income. With the loss of £25,000 a week due to the pandemic. With the number of our services suspended in line with government criteria, continued growth is a challenge for us in the coming year. However, we are responding and adapting fast and putting in place plans to ensure we continue to put the patients and their families at the heart of everything we do. To date, we have raised £530,000 towards our urgent coronavirus appeal, an outstanding achievement which would not be possible without the hard work and support of staff, volunteers and our local community. Looking forward to next year, we will continue to deliver the third year of our strategy. With Everybody Excellent, Empower and Education featuring high on our agenda as we continue to provide services for the people of North Hart, Stevenage and Bedfordshire. We will continue to collaborate with our local partners, including Isabel Hospice and our local NHS colleagues, to ensure we spend wisely every pound raised by the local community. With the Board of Trustees' support, we have set ourselves strategic objectives for the coming year, and we are realistic about the major challenges we face, supporting this with the income generation into next year. We have had some amazing achievements, and to name but a few: the continued growth and development of the Compassionate Neighbours work, the amazing amount of money raised by Young Betty, the extended support to the residents and care homes, and the development of our online facilities for patient and carers, the fantastic support for our very first marathon in Offaly, and the impact of our schools project in schools and colleges. I would like to introduce Mary Driver, the head teacher of William Ransom School, who shares her experience of the school project with us.
Hello, my name's Mary Driver and I'm head teacher at William Ransom Primary School in Hitchin. And I'd like to tell you about our experiences with working with the Garden House Hospice. So, Susanna from the hospice contacted us to see if we would be interested in taking part in the first school project at the Garden House Hospice. So we needed 8 volunteers, and luckily we got 8 volunteers. And so after an introduction by Susanna to the parents about how the project would run, Julie Hall and the 8 children set off for the hospice. It was the most incredible experience for the children. Julie Hall and the parents who came in for the last session just could not get over what had happened. The children just loved chatting with their patients and all had anecdotes and football jokes to share and stories about their own illnesses or family members who had illnesses or problems to overcome. The patients had wisdom, time and kindness to share and could tell the children how they were coping with their illnesses and what sort of things helped them and how the hospice helped them. The stigma of a hospice and of dying is no longer a stigma for them. They had such a positive experience. They also learned how important hospices are and how much they rely on the money raised by charity. After the visits, the children were very keen to donate money to the hospice and they were looking for more ways to raise money. They visited the wards and met lots of nurses and doctors who all took the time to chat and to joke with the children. Any of these children who now visit a relative or a friend in a hospital will now feel more comfortable doing so. There will not be the fear and nerves that can accompany such visits. This was a life-changing experience for them and for us. Empathy, compassion, kindness, all values that the children sometimes take time to learn and understand, but they all showed a level of maturity that we didn't expect to see at all. It really showed us that the children are never too young to learn about death and serious illness if it's tackled sensitively. The idea that a hospice would be a sad, quiet and scary place has been replaced. For those children, a hospice is a place where people meet to talk and laugh and do things to help them feel better. Thank you for letting us be part of the school's hospice project.
So finally from me, a big thank you to you for joining us today. I wish you a Merry Christmas and every best wish for 2021.